Senate Bill 31. Imagine this. Imagine a woman shows up at a small town Texas hospital with a pregnancy complication that could turn deadly. The doctor knows waiting could make it worse, but also knows one wrong call can mean lawsuits, license trouble, or criminal charges. The clock is ticking, and the law is still fuzzy. What the bill says it does? Senate Bill 31 says it clarifies when doctors can legally act in medical emergencies to protect the life of the mother. It claims to give doctors clearer guidance so they do not have to wait until a woman is on the brink of death. What it actually does. This means doctors can act earlier using what the law calls reasonable medical judgment, but only as that judgment is later interpreted by regulators and courts. It also shifts more control to state boards and court precedent, while doctors and hospitals still carry the risk of someone second guessing their decision. Who benefits? Pro life advocacy organizations that pushed for clear but still tightly controlled exceptions. State regulators like the Texas Medical Board and the State Bar, which gain new authority over mandatory training and interpretation. Some physicians who gain limited legal clarity, but not full protection. Who pays the price? Patients who may still face delays if hospitals act cautiously. Rural hospitals and smaller facilities that must meet new training requirements without added funding. And doctors whose medical decisions can still be challenged after the fact. Why it matters. In emergencies, hesitation can cost lives. If doctors and hospitals are still afraid to act, the promise of clarity does not always reach the bedside. When responsibility shifts upwards to regulators and courts, everyday Texans feel it in longer waits, uneven care, and different outcomes depending on where they live. Questions to ask your lawmakers. How will you make sure women receive the same emergency care in every part of Texas, not just in well-funded hospitals? What safeguards exist if hospitals delay care out of fear, even when a medical emergency is clear? Would you support a review or sunset to ensure this law actually improves patient care, not just legal paperwork? Bottom line, Senate Bill 31 promises clarity for doctors, but leaves many Texans wondering if life-saving care will still depend on legal fear instead of medical need.